Hello, so this is a long one. Drugs in perspective, cases, causes, assessments, family prevention, intervention, and treatment. Chapter 1, Putting Drugs in Perspective. Chapter 1 emphasizes the problem and perception that have misdirected efforts toward an effective approach to alcohol drug treatment, intervention, and treatment efforts. The chapter is designed to stimulate both classroom discussion and the exploration of your own biases, viewpoints, experiences, and personal opinions to help you put drugs into perspective. Lack of understanding. Historically, we have failed in our responses to the alcohol drug problem in the United States. Alcohol in particular has become integrated into the fabric of the mainstream American lifestyle, causing many people to minimize its impact and its cost to our society. It has been estimated that business and industry lose more than $136 billion each year for alcohol-related reasons. Reduced productivity, time lost at work because of absenteeism, illness and or personal problems, increased healthcare costs. The following section identifies major problems related to alcohol and drug abuse, alcoholism, and drug addiction. So, failed approaches, scare tactics. From the 1930s to the 1960s, public and private responses to alcohol drug abuse caused tremendous damage, which we are still trying to overcome. These approaches were riddled with personal, emotional reactions and political biases, which denied the real dimensions of the problem. Scare tactics, a politically based approach that alienated young people, which began in 1937 and continued to this day in a variety of forms. Those using scare tactic assumed that if young people were frightened by adverse reactions to drug use, they would be too frightened to use the drug. For most young people, however, scare tactic proved to be an ineffective approach because much of the information was exaggerated, overgeneralized, or sensationalized. As a result, young people did not perceive the source of such information as credible. In the late 1960s and early 1970s, President Richard Nixon declared his famous war on drugs. Even though an all-out war-like effort was needed and money readily available to fight drug addiction, no one knew how to tactically fight this war on drugs. Drug use had spread to epidemic proportions. Also, President Richard Nixon is not the ideal general for this war, having already alienated young people during another war in Vietnam. The failure of Nixon's war on drugs left a bitter taste in the mouths of government funding sources. Money for treatment programs was cut each year thereafter, and the focus shifted to prevention. Neglect of the demand side. Throughout the ensuing years, U.S. administrations continued to fail to develop a comprehensive and cohesive drug policy. Most of the administrations put a major emphasis on the supply side of the drug problem and significantly neglected the demand side. Emotional and political bias of these administrations caused them to be blind to the many causes of drug dependence and resulted in an adherence to a simple magical solution that was politically advantageous. Administrations focused on the supply side approach. They focused on drug trafficking and put little effort toward the demand side of the problem. Emotional and political biases of these administrations caused them to be blind to the many causes of drug dependence and resulted in an adherence to a simple magical solution that was politically advantageous. The myth of the simple magical solution. During the Reagan administration, the First Lady Nancy Reagan was influenced in shaping the U.S. approach to the drug problem. Although her intentions were noble and well-intended, the just say no approach illustrates a simplistic view of a complicated problem. Suggesting that adolescents and young adults can overcome the drive to alter consciousness, peer influence, the disease of alcoholism and addiction, and the many factors that influence alcohol drug abuse by just saying no, minimizes the obstacles to be overcome. A simple solution is easily understood and immediately reduces anxiety, shame, and emotional discomfort. However, a simple solution will not resolve the insidious, multifaceted problem of substance abuse and addiction. Drug use, abuse, and dependence are not easily understood. Mrs. Reagan made the mistake that many people often make. Too often, people search for that simple solution to an epidemic problem. Alcohol, the most problematic drug. Alcohol abuse and alcoholism are major problems that are often minimized or overlooked as not being a part of the war on drugs. Administrations have been distracted focusing on drugs, often forgetting to include alcohol as a drug. Alcohol is the most problematic drug we know of today in terms of sheer numbers. Estimates indicate that there are more than 12 million alcoholics in the United States, and that a significant number of other people meet the criteria for alcohol and alcohol dependence. Okay, binge drinking. According to the Center for Disease Control and Prevention, morbidity and mortality weekly reported excessive alcohol use is the third leading preventable cause of death in the United States, and more than half of alcohol consumed by adults in the United States is in the form of binge drinking. Such studies and statistics continue to prove the same point. Binge drinking is a significant problem on college campuses. Although binge drinking problems are very pervasive in college-age students, the problem is not limited to this age group. 6 Americans die each day from alcohol poisoning due to binge drinking. It is reported that 76% of those deaths are aged 35 to 64, and a majority of them are men. Alcohol and violence among the general population. It is estimated that alcohol is involved in 25 to 50% of cases of intimate partner violence. The psychophysiological effect of alcohol use can lead directly or indirectly to intimate partner violence. Alcohol abuse can also lead to exacerbation of already dysfunctional marital relationships and have negative effects on family life, which increase the probability of violence. Accidental injury is the leading cause of death among older adolescents and young adults, and binge drinking is involved in many of these accidents. For young people under the age of 21, intentional deaths include homicides and suicides that are alcohol-related. Systemic problems of drugs. A large portion of the federal money available to fight the drug problem is being spent on programs and agencies that focus on reducing the supply of drugs in the United States. Despite these efforts, there appears to be no real reduction in the availability of drugs. The lucrative profits are such a strong incentive at every level of the illegal drug trade that government efforts to decrease drug trafficking have not been successful. The U.S. federal government's role in the drug problem. The strong emphasis on the supply side funding has been neglected for demand side programs of drug prevention, intervention, and treatment. The program has escalated to levels that respected government officials and other prominent individuals are considering the legalization of illicit drugs. Even considering legalizing drugs clearly points to the frustration of the segment of the American society with a lack of progress being made by the supply side approach. The average waiting time for publicly funded outpatient alcohol drug treatment can be a month. The average waiting time for publicly funded inpatient alcohol drug treatment was 45 days. Nationally, more than 65,000 people are waiting to enter public alcohol and drug treatment programs. Money alone cannot necessarily solve the problem. However, it can alleviate delays in providing treatment for those desperately seeking and needing treatment. Funding for innovative programs addressing the needs of the inner-city crack addict and programs for the prevention of addiction in pregnant women are high priorities. Innovative with realistic methods of funding are also necessary to attract the support of big businesses. So, racist approaches to the drug problem. There has been a prejudice and oppression of people of color, a scapegoating of minorities, and neglect of substance abuse problems in the inner city. Legislation on drug policy has often based more on racial scapegoating prejudice than on a concern for the harmful impact of drugs on people. People's attitudes toward a specific drug became inseparable from their feelings about that group of people with which the drug use was associated with. This is evidenced throughout history to the present day. For instance, in 1875, the goal of suppression, opium smoking, and opium dens had little to do with the control of opium, but more to do with the fear of interracial contact and a fear of interracial mixing of the Chinese with American women and the white working class. The historical association of drugs with minority groups include the following: opium with the Chinese, cocaine with African Americans, alcohol with urban Catholic immigrants, heroin with urban immigrants, and marijuana and PCP with Latinos. The underlying assumption that minorities were not able to control or tolerate the use of alcohol and drugs because they were lazy and morally weak. Of course, it was thought most self-respecting white men could control their drug use. Unfortunately, as long as drugs were confined to minority groups, funding and treatment resources were limited. It wasn't until the 1960s when the white, middle, and upper-class young adults and college students were using marijuana, hallucinogens, and other drugs that the modern drug war began. Until we resolve the more dramatic issues of socio-economic inequalities, racial prejudice, and the oppression of minorities, inequalities of pay and occupational opportunities, and other related issues, the inner city will continue to be a breeding ground for abuse of alcohol and drugs. So, socioeconomic inequalities that undermine the American dream. The inequalities in socioeconomic opportunities have created bitterness, racial conflict, and general rebelliousness and hopelessness, which fuel the desire to use alcohol and drugs. The American dream is a nightmare for those who are unable to develop feelings of complacency and pride in their lives. Elizabeth Schur identifies poverty as the greatest risk factor for chemical dependency and other destructive behaviors. Violent crimes, school-age childbearing, and school failure are outcomes that need early interventions to prevent rotten outcomes, and high-risk families need high-intensity services. Changes in economic policy, healthcare reform, and welfare reform can help in breaking the cycle of disadvantage. American society needs to acknowledge and address these issues of disparity and opportunity. Other factors contributing to the alcohol and drug problem are the breakdown of the neighborhoods, changes in traditional nuclear and extended family system, limited support systems, stress, and trauma. Academic failure and the role in the U.S. education system. The U.S. education system has become so neglected that the rates of academic failure and dropout are continually rising. The academic standards for students who do not graduate are inferior. The ripple effect is lowering the academic standards is seen in colleges and education in general. Illiteracy is increased, and the quest for knowledge and general personal and intellectual improvement is not emphasized or valued by the average American citizen. This complacency in education affects the standards in American business and industry. The worker who has no motivation for personal improvement also is not motivated to do high-quality, productive work on the job. The quality and pride in American workmanship are also decreased, resulting in inferior goods and services, and a general public attitude that accepts these standards. The industries that employ individuals with good educational backgrounds and positive self-motivation attitudes tend to experience fewer of these problems. The current failures of the U.S. educational system result from a variety of problems. The biggest problems are poor administration, teacher burnout, lack of adequate funding, and a bureaucratic system that promotes complacency. So there are different perspectives for drugs. This one is the moral legal perspective. It is primarily the viewpoint of law enforcement and criminal justice system. The major focus of this perspective is to keep specific drugs away from people and people away from specific drugs. This approach reduces the availability of drugs and uses punishment as a deterrent in addressing the supply side of drugs, not the demand side. The moral legal perspective is the one emphasized by most politicians, yet this perspective alone cannot be effective unless we address the demand side. The moral legal perspective is ineffective. With so many buyers in the market, sellers are motivated to deal despite the risk. Then we have the medical health perspective. The medical health perspective is held by physicians, nurses, and the medical and health treatment fields. In this perspective, alcohol and drug use is a public health problem. Treatment focuses on the physical damage related to alcohol and drug use, abuse, and dependence. The medical health perspective assumes that people seek good health. The perspective is also based on the assumption that health information influences attitudes and behaviors. However, information alone does not change attitudes about alcohol and drugs. Next, we have the psychosocial perspective. The psychosocial perspective is a common viewpoint shared by a variety of agencies that specialize in addressing the demand side of alcohol and drugs. The services these agencies provide include the following: recovery from substance dependence, intervention and treatment services, early intervention approaches with adolescents, prevention services for young children, adolescents, adults, and seniors. The goal of this perspectives is to prevent, intervene in, and treat alcohol and drug problems. Inadequate funding for chemical dependency treatment programs and our alcohol drug prevention programs has made it difficult for many users to obtain treatment services and for agencies to maintain prevention programs long enough to see conclusive results. The social cultural perspective. The social cultural perspective is held by most social agencies and institutions. The basic goal of this perspective is to adapt the environment to meet the individual's needs. The underlying assumption of this perspective is that alcohol and drugs use is due to the frustration and hopelessness of people's lives. So this is just a few questions. So what is your perspective of alcohol and drugs? Should they be legalized? Is the supply side approach to the drug problem effective? Is alcohol drug addiction a defense for irresponsible criminal behavior? Is alcoholism drug addiction a disease? Describe the physician's role in making a patient aware of problems with alcohol and drugs. Do people need more information about the health risk of alcohol and drug use? And does this information change attitude? What role does parenting play in the development of alcohol and drug addiction? And how can treatment be more effective? Perhaps the problems that spawn alcohol and drug abuse and addiction seem too difficult to overcome. The negative impact of these problems frequently gives rise to the feelings of hopelessness, that we can never adequately resolve these issues. However, there has been positive and dramatic success. Millions of Americans are in recovery for alcoholism and drug addiction. So that's it for this chapter. Thank you for listening.